fat grafting itself can be either performed as an isolated procedure, or it can be performed in conjunction with a larger surgical procedure under general anesthetic. The procedure itself requires the surgeon to identify areas of deficiency, specifically volume deficiency, and as an example, we'll use the face. Once those areas have been identified and marked, the surgeon will then choose an appropriate harvest area, usually the abdomen or flank, and that area will be anesthetized with local anesthesia or a tumescent solution in a scenario where a larger volume of fat is required. The surgeon then goes to the area of the recipient site, the cheek, and would put in a number of nerve blocks using local anesthesia to ensure that the entire field is anesthetized. Once that's accomplished, using a small scalpel, the surgeon will make a 3 millimeter incision in the area of the fat harvest site, and using a suction-based cannula system, the surgeon will use that to extract whole fat cells. Specific tailored cannulas for the process have to be used to avoid unnecessary damage to the fat cells. Once they've been extracted in adequate volume, they get washed and processed and then transferred to larger syringes, and then through a Luer system are then again transferred to fine 1 cc syringes for introduction. The surgeon would then use special blunt-tipped cannula of different shapes, sizes, and lengths to be able to reintroduce the fat cells into the new site. Again, this is done with a 3 millimeter incision, and then multiple passes are made in different planes to add volume in a layered fashion, transferring those fat cells in a smooth, reliable way into the new recipient bed. Using blunt-tip cannulas tries to reduce the risk of trauma to the surrounding vessels and tends to avoid the introduction of fat into the vessels themselves, causing small fat emboli, which is certainly one of the risks of the procedure. Once an adequate amount of fat has been transferred, the surgeon then removes the cannula, puts a small single suture at each of the donor and the recipient incision sites, and the areas are allowed to heal with just a fine light dressing.